Today's event is brought to you in partnership by the Cleveland Clinic along with the Arthritis Foundation. And just a little bit more about our team here at the Cleveland Clinic. Our orthopedic and sports medicine team is dedicated to helping you regain mobility, reduce pain, and enhance your overall quality of life. So whether you're dealing with joint issues, fractures, sports injuries, our experts are here to provide the advanced treatment options and experience that you need to get back to being you. And a little bit about our partners over at the Arthritis Foundation. The Arthritis Foundation is where you'll find help, hope, and a caring community who understands what you're going through. Turn to the Arthritis Foundation for trusted information, tips, and tools, plus ways to connect with others who face similar challenges. The Arthritis Foundation puts the needs of people with arthritis front and center of everything that they do. All right, I would like to formally welcome everyone to Finding Relief, sports injuries at any age, pickleball, tennis, and more. We have a wonderful event for you today with two really great specialists, and I would like to begin by introducing our first speaker, Dr. Joe Tramer. Dr. Tramer specializes in both non-operative and operative treatment of knee, shoulder, and elbow injuries in patients of all ages and levels of activity. Dr. Tramer's priority is getting patients back to activity and out of pain without surgery. But when all else fails, he has advanced training in arthroscopic and open techniques to restore anatomy and function. Dr. Tramer is a Northeast Ohio native who was born and raised in Beechwood and received his undergraduate degree from the University of Michigan and attended medical school at Northeast Ohio Medical University. He completed his residency at Henry Ford Hospital in Detroit, where he gained early exposure to caring for athletes, including assisting in care of the Detroit Pistons and Detroit City FC. Following his residency, he completed an orthopedic sports medicine fellowship at Stanford University. Dr. Tramer has authored numerous publications, earned prestigious recognition and awards, and has contributed several technique videos demonstrating his expertise. In his free time, which I can't imagine after all that you have very much, Dr. Tramer, he enjoys running, being outdoors, and spending time with his family. What an absolute honor to have you here with us. And without further ado, please take it away.
Thanks so much. Nice introduction. I appreciate that. As you said, I'm Joe Tramer, one of the orthopedic sports medicine surgeons here at Cleveland Clinic. And I was tasked with talking today about finding relief, sports injury at any age, and I look forward to sharing some of my thoughts on this topic. So just what we're trying to accomplish today is to understand some of the changes that we go through as we grow older. And we're going to really focus on my expertise, which is musculoskeletal issues and the changes specific to that system of the body, and then how we can prevent and treat injury while trying to stay active. So as I said, the whole body goes through a number of changes as we age. And specifically, I'll go over some that are of concern to me as an orthopedic surgeon and for when people try to get active. And it's important to weigh the risks and benefits of physical activity with some of the changes that go through. And I think this is a really timely time to talk about this. As you can see in my photo there, pickleball has been on the rise, and I probably see a patient a day who is starting to become active because it's a great sport. It's an easy way to become active. It's fun, it's social, but it's not benign. It does require cutting, pivoting, things that some people may be just getting into or not quite used to, or it's been a while. So I want to highlight some of the reasons why this sport in particular, as well as other sports like tennis, running, can lead to injury and what we can do to prevent it. Because the goal is we want to exercise. There are innumerable benefits of exercises. Here's just a list of some of them. It improves your muscle mass, your heart health, really all of your organ systems. It can help you sleep, maintain healthy brain, weight. So there's many reasons why we want to do it, but we want to make sure we're doing it safely because the body does go through many changes as years go on. So I'm an orthopedic surgeon. I love bones, so I'll start by talking about that. As we age, we lose the density or hardness of our bones. And this is important because it can increase our risk of fracture. So you can see on this graph here, we gain bone mass, but then it starts to taper off as early as in our 30s, 40s, and 50s. And then it drops pretty significantly, especially in women as they go through menopause. So you can see a large drop off in bone mass. And this can be dangerous because the bones become more brittle, can lead to fracture. So we want to make sure we're doing things safely for this reason. In addition to the bone, the muscle goes through similar changes where you can see that it peaks around middle age, and then the rest of the time it's kind of declining. So our job for both of these things is it's going to go down, but we want to flatten out that curve and make it less steep to maintain as much mass as possible moving forward, as decreased mass can lead to some of the injury, which I'll talk about later. The joints also undergo changes, and it's a delicate balance. Cartilage is the smooth lining of our bones that let our joints glide smoothly against each other. And if you don't use it enough, it can kind of wear out from lack of use. And on the other hand, doing too much repetitive activity, especially if your muscles aren't strong enough to support the joint, can damage the cartilage as well. So there's a middle ground that we have to try and hit to prevent us from having injury. And then once the smooth lining of the bones, the cartilage wears away, the meniscus is what's between the two. It acts as a shock absorber. And instead of the cartilage gliding smoothly, it's more sandpapery and can lead to small tears in the meniscus. And those can get caught and cause pain and dysfunction. So this is a spectrum of disease that I see a lot, and we'll talk about it a little later as well. Tendons are what connect the muscle to the bone and allow movements. And as we age, those go through changes as well. They're not as strong. The blood supply gets a little more poor, so they're vulnerable to injury, and they don't heal as quickly. And just in general, there's been a lot of research on how performance changes as we move on in life. And pretty consistently, there are drops in strength, balance, and walking that occur into our later years. So all this together seems like a lot of change. Fortunately, there are ways we can combat this. And like I said, aging works against the musculoskeletal system. These things are inevitable. Our goal is to slow these changes in a safe manner and keep people active and strong for as long as possible. So I just wanted to talk about some general athletic injuries that I see most commonly. And a lot of these things are caused by those age-related changes. This is one of my favorite stock photos. It's just a ridiculous picture. So the first one is muscle strain. This is something I see very commonly. And what happens is that folks try to get back into something where perhaps their muscle isn't quite as strong as the activity they're trying to do. So by doing a large movement, the contraction of the muscle overpowers what it's able to withstand, and that leads to small tearing in the muscle. There are different grades of it, but essentially it leads to pain and dysfunction. And it's a combination of two things. One, the muscles can be weaker, and when they're weaker, they're more susceptible to this. Also, if they're weak and you've played a few games of pickleball and you want to just play that one more, they might be fatigued and not able to protect themselves the way they want to. So muscle strains are very common. It can happen to any muscle group. And the fortunate thing is that this gets better fairly reliably. Treatment includes relative rest, some therapy to re-strengthen the muscle once it's healed, heat and ice, anti-inflammatories, and topicals. But it's frustrating because it takes a long time. And the more it happens, the longer it can take to recover on each one. So when it does happen, it's something that we want to take seriously. We want to take a step back from what we're doing and really make sure that the muscle is able to be built back up before we get back into those higher level activities. In order to prevent muscle strain, we got to get them going before we ask them to do heavy work. So a proper warm-up. These are just some simple stretches that I would recommend just to get things loose. Regular exercise. One of the reasons this happens is because the muscle tries to do something it hasn't done in a long time. If we exercise regularly, then the chance of that goes down. And fatigue management. It can be tempting to get one more set, one more game in, but the muscle only has so much capacity to work at once. And as we fatigue, it gets more vulnerable to injury. So being realistic about how much load you can handle and slowly increasing that over time rather than jumping is a key to prevent this. Related to muscle are the tendons. The tendons are areas where the muscle attaches to bone. A healthy tendon is very organized and has a great blood supply, good capacity to regenerate. And as we age, it gets a little more disorganized. The blood supply gets a little more poor. So this leaves it vulnerable for injury and pain. These are some of the most common injuries I see, especially in the population who's trying to stay active into later age. It can happen to a lot of different tendons. These are some of the most common ones, and especially related to pickleball, a lot of shoulder, which is rotator cuff, and tennis and golfers elbow, which is inflammation of where the muscle attaches around the elbow. And these are very common things that I see. And the good thing about it is that, again, like muscle strain, the majority do not require surgery, but they're very frustrating. They can linger for many months, and there's not really quick fixes to a lot of them. The spectrum of treatment remains similar to muscle strain, and really the key is maintaining strong muscles to prevent this from happening. This picture on the bottom, you can often see on a pickleball court, one person has a knee brace, one has an elbow brace, one has a strap. So trying different things to try to offload the tendon to keep you out there playing are things I recommend. And there isn't a magic treatment or combination of these things. A lot of it is trial and error, figuring out what is enough to get you out there, but not too much where you're in significant pain afterwards. And in rare occasions, especially in my specialty, which is more of the shoulder, these can go on to needing surgery, but I do everything I can to keep you out of the operating room because that can lead to significant time off from playing. And then I'll touch on osteoarthritis as well. And like I mentioned before, arthritis is when the smooth lining of the bones, the cartilage, wears away over time. And it's one of the most burdensome diseases in our entire healthcare system because inevitably everybody gets at least some degree of it. It's just a question of whether it becomes symptomatic and what to do about it. So here's a diagram of kind of what it looks like. And you can see on the normal side, that blue spot is that nice thick cartilage. The meniscus, the shock absorber, sits in the middle of it. And that side looks really healthy. What happens is that holes can develop in the smooth lining of the bones. It can chip and wear away. And when that happens, the bone is exposed. The bone has nerves in it and it rubs against other bone. And your body does not like that. The meniscus, the orange thing in the middle, can get kind of chewed up. And this can cause a lot of pain and can happen to any joint. But I most commonly see it in my practice in the knee and the shoulder. I'll often get x-rays, and this is a pretty obvious one, I think. But on one side, you see that the ball of the shoulder is nice and round. There's gray space between the ball and the socket. Versus the other side, it looks like the shoulder's been mashed into the socket. It's starting to deform and flatten. And you can imagine how painful this x-ray might be. This is very advanced stages, and it comes in a large spectrum. And it's a very tough condition because the only way to definitively treat the problem is to do a fairly major surgery and resurface the joint. But obviously, we don't want to do that to everyone with arthritis, so it becomes managing the middle ground. So the real way to prevent and stave this off as best as possible is to increase the muscle mass, which protects the joint, makes it so it doesn't rub the wrong way as much, and decrease the load on the joint. That's living a healthy lifestyle, trying to keep weight off, especially in the knee. Every pound we carry around is magnified 5 to 10 times across the knee joint. So 5 pounds either way can add 50 pounds of pressure across the knee. And if you have cartilage wear, that really gets magnified. There's a lot of different things we try that are all similar to decrease the symptoms. And sometimes, especially in my practice dealing with shoulders, you can imagine that x-ray there, the ball is really flat, it's mashed against the socket. Trying to play a racket sport would be very difficult with a bone grinding against the other side of the bone. So in those cases, after we've failed all those other things, surgery is a very good option. This is an example of a shoulder replacement that I do, where we try to minimize how much of the bone we're taking, and we do just enough to reshape those surfaces. So now you have a smooth gliding surface. And people can get back to very high levels of activity with these types of surgeries. Obviously, there are risks involved, but in patients with debilitating arthritis, it can be a very great option. And my goal as a sports surgeon who does this is to get people back to playing sports and the things that keep them happy and active. So I mentioned time and time again that I want people to stay fit and active as best as possible to keep their muscle mass. So I think Hanna will go into this a little bit after me, but I just wanted to touch on some things that I want people to focus on when it comes to preventing these injuries. One is flexibility. We want to keep the joints as loose as possible and the muscles well stretched. And we want to make sure we warm up. And this is something that should be done, I would say, a couple times a week in conjunction with other activities. Aerobic exercise is extremely important. It's great for the heart. Some impact is good to keep the bones strong. And it should be a mixture of moderate and vigorous activity. And that's different for everybody. Instead of saying you should run a mile at this time, I say you should make it your own and use like a 5 out of 10 exertion scale. So that might be different for everybody. And you want to mix in a little bit of moderate and a little bit of vigorous. And I always like to tell people, especially if they have some early arthritis, I'm never going to tell you not to run, but that does involve more impact to the knees. Things like elliptical, swimming, bike, less impact, less chance of causing symptoms. But I always work with people, if running is their thing, like it is mine, I want to get you out there and keep you there if that's what you want to do. And I think resistance training is something that's very overlooked and extremely important. We saw that graph, the muscle mass starts to go down between ages 40 and 50. And we really want to do what we can to flatten that curve out. And because in later years, the more reserve we have, the better we're going to be. So taking the time now to do resistance training, which many people didn't do growing up, is extremely important and something that the patients I see typically aren't doing. There are very simple ways to get involved. I give people who come see me with shoulder problems bands and similar exercise to this. They can do them at home, where it doesn't have to be anything crazy, but it's enough where the muscles are pulling against something and getting stronger. And then you can increase the resistance of the bands, use light weights. And these are very important things to do. Same with the lower extremity. It's not too burdensome to take some time out of your day to work on some resistance training, because that's going to be the most important thing to protect from injury into the future. And I always say this, something is better than nothing. Even if it's walking from your golf cart to the green and back, that's better than sitting on the couch. Doing 5 minutes of resistance training is better than 0. And over time, you can build with it. So doing whatever you can to get started, and something is always better than nothing. I would say before getting started with something, it's important to seek treatment, especially if you're going to start doing cardio activities. If you haven't seen your primary care doctor in a long time, making sure your heart and lungs are in good shape. Your preventative care is all up to date. A primary care visit would be an important thing before starting something that you haven't done before. And then if there's an acute injury, a pop, you can't walk, it's really swollen, those are reasons to give us a call. Or a chronic injury, your elbow hurts, it's been hurting for a couple months, it hasn't gotten any better, give us a call, we'd be happy to take a look at it. I wanted to just touch on expectations if you come see anyone here at the Cleveland Clinic, but this is kind of how I go about things. I typically get x-rays before your appointment. They're low cost and can tell me how worn away the joint is very quickly and easily. And I'd like to sit down and go over them on the screen together during our visit. I do a thorough history and physical examination, and I might order extra imaging. And I provide everyone with an individualized treatment plan. My objective is to understand your current and your future goals. And age, in my mind, has nothing to do with this. It is mostly an activity level type of decision. I saw 2 patients last week in clinic. One of them was in their 60s, one in their 30s. Both had ACL tears. The 60-year-old plays tennis, skis, runs. The 30-year-old just goes to work and sits a desk job. I recommended no surgery for the 30-year-old, and we're doing the ACL in the 6-year-old. So it all has to do with activity level and goals. And age is factored a little bit, but is not the primary driver for me. I'll provide an accurate diagnosis and make sure you understand it. And then I like to come up with a treatment plan with the best risk-benefit profile. I am a surgeon. I love doing surgery. I'm in the middle of my surgery day right now. But I only want to do it if I have a very high likelihood that it's going to make you significantly better, because even minor scope surgery that I do comes with a fairly large risk profile. So I maximize non-surgical treatment when it's appropriate, but there are certainly those subset of cases where we have to move on to doing something more definitive. And I would be happy to recommend that as well, but only when I'm very confident that it's going to make things better. So in summary, I want everyone to get moving, but safely. That means different things for different people, depending on your baseline. And I really want everyone to build a foundation. If you haven't done anything, you got to start simple. If you're already advanced, you have a good foundation, maintain or keep going. And if you're ever in doubt or you want to talk about it beforehand, myself, Hanna, many of us at the Cleveland Clinic, we're here to help. Feel free to give us a call. So thank you.
Wonderful. Thank you so very much for that great presentation. We really appreciate it. Dr. Tramer is going to go off camera right now, and he's going to join us back for our Q&A segment. So please ensure that if you are thinking about something, if you have a question, if you want us to elaborate a little bit more, you can go ahead and send us a question on your right-hand side. So thank you very much for that presentation. And now I'm going to introduce our second speaker, Hanna Marchant. Hanna earned her Bachelor's of Science degree, Bachelor's of Science in Exercise Science from Gannon University, and her doctorate in physical therapy from the University of Pittsburgh. She is a certified strength and conditioning specialist with internship experience from the University of Pittsburgh Sports Performance Department, and as an assistant strength and conditioning coach at Mercyhurst University. Hanna conducts research on the validity and reliability of affordable technology, presenting her work both nationally and internationally. She is currently completing her sports physical therapy residency here at the Cleveland Clinic. Her residency duties include working with the Cleveland Guardians and the Cleveland Cavaliers, alongside with her primary role as a sports physical therapist for St. Edward High School, John Carroll University, and Spire Academy. Well, Hanna, thank you so much for being here. Another impressive presenter. We are so excited. So please take it away.
Thank you so much. I really appreciate it. And thank you, Dr. Tramer, for the great presentation and kind of teeing up this part of the presentation on some non-operative treatment and things that you can do to not get yourself in a pickle. Best methods to avoid injuries at any age. Now, I want to welcome everybody to this part of the program, and I'm here to guide you on how to prevent these injuries and build resilience in sports. So first off, I have nothing to disclose about this presentation. And then a little bit more about myself. So like she said, I am the current sports physical therapy resident here at the Cleveland Clinic, and I'm really excited to share this information with you. And then a little bit more background. So I've been playing sports pretty much my entire life. So it wasn't a surprise that when I started school, it didn't take me long to realize that my passion would lie in treating athletes of all ages. I have experience in physical therapy and strength and conditioning at the high school, college, and professional levels. So it's safe to say that sports really do mean a lot to me. Now, it shouldn't be a surprise that sports also mean a lot to you. In fact, here are some statistics on sport participation across the world. So each year, approximately 9.5 million golfers in the United States are age 55 and older, and they take the course. This group represents a significant portion of the golfing population, with that age group comprising about 1/3 of all golfers. And then the Sports and Fitness Industry Association reported that pickleball in 2019 had around 3.3 million players. Of these, 2 million players were classified as casual participants, so playing 1 to 7 times a year, and 1.3 million were core participants, playing 8 or more times a year. And then let's not forget about tennis. The Tennis Industry Association reported that tennis had 17.8 million players. Of these, 1.8 million players, or around 10%, were age 55 years or older. So it's safe to say sports are very popular and important to you. Now, sports are also great for you. In 2019, Stenner and colleagues reviewed reasons why older adults should play sport, and they found 4 key purposes. They aimed to identify studies from the literature that evaluated why reasons for older adults to play sport, and then synthesize and discuss these reasons. So what they found was that the first major reason was for their physical and mental health. So engaging in sports offers significant benefits for adults, both physically and mentally. Physically, regular participation in sports helps maintain muscle strength, flexibility, and cardiovascular health, trying to reduce the risk of chronic diseases like heart disease and diabetes. It also enhances balance and coordination, lowering the risk of falls and related injuries. Mentally, sports provide social interaction and reduces feelings of loneliness and isolation. They stimulate cognitive functions, improve memory, and overall brain health. And additionally, the sense of accomplishment and enjoyment derived from sports can boost mood and reduce symptoms of anxiety and depression, contributing to a higher quality of life. Now, sports can also offer a sense of community. They play a vital role in enhancing the sense of community among adults. Participating in team sports and group activities fosters social connections, helping individuals build and maintain friendships. These interactions create and support a social network that combats feelings of the social isolation and loneliness. And then being part of a team or club provides a shared purpose of collective goals, promoting a sense of belonging and camaraderie. Next, it also fosters a nice sense of healthy competition. So competition fosters that sense of purpose and motivation, encouraging individuals to set and achieve their own personal goals. It stimulates mental sharpness and strategic thinking, and also boosts self-esteem, providing a sense of accomplishment. And then lastly, the last thing that they found in that systematic review is that it provided you guys a reason to travel. So the anticipation and enjoyment of travel can reduce stress, boost mood, and create lasting memories while you're competing. So now, while sports are very good for you most of the time, playing a sport can also provide some inherent risks from the exposures that you have. So in 2021, Weiss and colleagues published this paper investigating the trends of pickleball and tennis-related injury, and it's pretty interesting what they found. So if you're going to look on this graph here, specifically across the 60 to 79-year-old cohort, pickleball injuries are on a steep rise, shown in this graph here on the red. Injuries to a lesser extent can be seen specifically in the 50 to 59-year-old cohort and also the 80-year-old cohort. And then if you look all the way on the left, pickleball injuries in the younger age groups are staying pretty consistent. Now, if you look at this graph here, not only have those younger age groups stayed pretty consistent, tennis injuries across all age groups have stayed consistent. But here you can see the differences between the trends in pickleball and tennis. So on the left, on your screen, you're going to see how the pickleball injuries are steadily increasing, while tennis has stayed pretty consistent over the years. Now, with data to support both the increase in sport participation and the increasing injury incidence, we must ask ourselves, how are we going to keep participants resilient in sport at this point in life? So particularly, I think of three principles that are important in sport resiliency, and they include a proper warm-up, strength training, and graded exposure. And I'm going to break these down for each of you, and we're going to talk about them in the next few slides. So the first one is the warm-up. Any dedicated warm-up before activity can provide many benefits for the session at hand and your ability to stay resilient in sport. Some things that a warm-up can provide include increased blood flow to muscles, which enhances oxygen delivery and nutrient supply, which helps prepare you for more intense activity. It also has increased ranges of motion needed for the sport, so gentle movements and stretches during the warm-up increase the flexibility of muscles and joints, allowing for a greater range of motion and reducing that likelihood of injury. And then it even improves muscle performance, so gradually increasing muscle temperature. Warm-ups improve muscle elasticity and efficiency, reducing the risk of strains and sprains. Now, I like to use this general framework for a good warm-up, which starts with some light movement, moves into more dynamic stretching and activation, and then finishes with you ramping up with some sport-specific drills. So let's talk about the breakdown of this framework. Ideally, the warm-up would start with a light dynamic activity such as walking, jogging, or cycling to get the muscles prepped and warmed and ready for activation. Next, dynamic stretching and strengthening activation exercises are a great way to further prepare. Consider active movement of both the upper and lower extremity and possibly some light bodyweight strengthening movements such as heel raises. And then lastly, increase the intensity of activity with some shuffling, walking lunges, or short running bouts. Consider some movements that you might need to do within the sport itself. So here we are going to shift to some videos so I could give you some examples of these exercises. So the first video here, and please feel free to take videos of any of these exercises so that you remember them. You're going to have the side shuffle, which is a great prep for sports like tennis and pickleball, where you may have to move in a lateral fashion. Ease into this activity and start with short distances at slow speeds. Next, we're going to move into the video that's after this, which is going to be the walking lunges. And again, please feel free to take a video of this. This is a great dynamic activity to warm the legs up and move them through greater ranges. If this movement seems daunting or difficult, start with this in a static position and use some hand support, and then start moving after that. In the last video, we're going to show some jogging to backpedaling, and this is going to incorporate some light forward and backward movement, again to prepare yourself for on-court movements that you might have to do within the sport itself. And that's good with the videos. We'll come back to the slides here. And so now let's focus on this number 2, which is strength training. And I know Dr. Tramer kind of went over this a little bit. I'm just going to touch on a little bit more to kind of drive home these important points. So the American College of Sports Medicine recommends at least 2 non-consecutive days a week of moderate to vigorous intensity strength training, with intensities noted here on the slide. Now, You might be thinking, Hannah, what does RPE mean? What does it mean? How do I know if I'm working hard enough? So this is the scale that I'm referring to. It is your own rating of perceived exertion, or how hard you think you are working at the task. The guidelines suggest strength sessions that vary between moderate intensity, which increases breathing rate, but you could still hold a conversation within the activity. And then also vigorous intensity, where you now may be only able to speak a sentence or hold a conversation that would probably be difficult. So you're going to try to stay between those two ranges when you're doing the strengthening exercises. So here I'm going to give a brief example of some exercises that I think would be ideal in helping any adult prepare for sport. I'm going to start with a lower body focus, and you're always going to want to start with that little bit of a ramp up, a little bit of a jog, walk, or cycle to get things going. And then here are some general exercises that I listed on the slide. These exercises will hit the major muscle groups of the lower extremity and then reduce that risk of injury as your strength increases over time. We're going to move to a few more videos here. And please, again, feel free to take videos of this so you remember. So first on the slide here is the side plank hip abduction, which is the modified version where you're going to be planting on the knee. This is going to target the abdomen, the core, and both of the lateral hip muscles. You're going to want to do this exercise on both sides to get the best benefit. You want to focus on keeping your bottom hip as high as possible, and while keeping that steady, you're going to lift the other leg. You should feel this in both lateral hips and also the core. And then if we move to the next video, the next video is simply the progression of the modified exercise. This is the full plank, as you can see. So this is the harder version, and you're still going to want to do the same things. You want to keep that bottom hip up and lift the top hip and stay controlled through the exercise. Do this on both sides. And then we can move into the next videos, which are glute bridges. Again, please feel free to take videos. This is the double leg glute bridge, which is going to target the posterior chain or the back of your leg muscles. You're going to flatten your back against the floor, tighten your core before lifting your butt off of the ground. Do not arch your back at the top. You want to keep that core tight, almost like a flat table across your body. And then the next progression, again, is a harder version of the first exercise. And this is the single leg glute bridge, where you should still perform the same movement as the double leg, but now with only one leg. It's a little bit harder of a progression. You're still going to want to keep that core tight, that back flat, and lift your butt up off the floor. And then we can move back into the slides here. So now let's talk about the upper body a little bit. Here are some examples that I think are great, again, for general strength and sport resiliency. They need little to no equipment, and they hit the major muscles important for some of the most popular sports. So let's look at some video examples. The first one you have here is the banded low row. So you can anchor the band in front of you almost anywhere, even against the courts before a game of tennis or pickleball. You want to relax the top part of the shoulders and squeeze your shoulder blades in the back together and row your arms back. You want to keep the tops of your shoulders really relaxed so you're hitting those back muscles and not shrugging to get the band back. And then we can move into the next banded exercises, which we're going to show videos of here. This is internal and external rotation for the shoulder. So the first video you should be seeing here is the banded internal rotation of the shoulder. So this is going to work the rotator cuff muscles that are so important in paddle, racket, and even club sports. You're going to anchor the band again around elbow level and keep your elbow as close to your body through the movement. You can use a towel to discourage your arm from leaving your side during the exercise. And if we move into the next video, I'm going to show the opposite, which is external rotation. You would just turn around for this movement. So it should be the same setup with the band about elbow level, anchored away from you. And you're going to rotate the arm away from the body. When you're doing this, it's important to try to not bend your body to move the band. That may be a sign that the tension of the band is a little bit too heavy for what you should be doing now. Again, use that towel to try to keep your arm close to your body instead of moving it away and compensating a little bit here. Okay. So let's shift gears a little bit, and we're going to be talking about the third focus, which is graded exposure. Now, I'm going to use an analogy. So I want you to imagine a new swimmer. someone who has never swam in their life, or someone who has not swam in many years? Would the first exposure to swimming be jumping off the high dive and diving into deep water and swimming many laps? Probably not. So now I want you to imagine the same thing in regards to your sport. If you have never played the sport before, or haven't even played in a really considerable amount of time, would you jump right back into the highest level of sport all at once? My suggestion would be to grade the exposure over time in order to train the body to get used to this new stimulus. Gradually increasing the intensity and duration of exercise helps prevent injuries by allowing muscles, tendons to adapt slowly to the new stresses that you're putting upon it. Now, often injuries can happen because of the mismatch between the level of stimuli that the body is accustomed to and something that's brand new that's getting thrown at it. So I want to give you an example of a graded progression for somebody that is just starting to play pickleball per se, or somebody that is just returning to the sport after some time off. Now, this timeline might be faster for somebody with more experience that is just getting back into it, or longer for somebody that is completely new to the sport. So think about it in stages. So stage 1, you'd introduce yourself to the basics. You'd want to learn the pickleball rules, the equipment, and basic strokes like the forehand and the backhand. Then you might practice those skills for forehand and backhand and introduce a volley technique and mini games with some friends to work on your control and accuracy, not getting into a full game scenario quite yet. Then you're going to want to start to build the skills. So review and refine those forehand and backhand, focus on volley technique, and then combine the skills in a controlled rally situation with friends. Practice serves and returns. And then the next stage, you want to get into some partial gameplay. So don't quite yet get fully into a full game, a full intense game, but play sections or go for a shorter game with known friends. Get used to that stimulus without the full thing yet. And then, of course, stage 4, get right into the game. This is where you are ready to experience the full stimulus of gameplay. Your graded exposure to the sport has allowed your body to adapt, and now it's ready to go. So let's say even after all of those things, you start to feel some pain and worry about injury. You say, Hannah, I've been doing my warm-up, I've been strength training, I graded my exposure, and I'm still feeling pain. Can I keep playing? How do I know when to stop or push through? So here, I'm going to discuss my traffic light approach to confronting pain head on to try to make the best decision for your health. So let's dive in. And first, we're going to talk about green light circumstances and some signs that you should be okay to push through some discomfort. So think about just mild discomfort. You might feel a slight, manageable discomfort that doesn't interfere with your ability to play or function. You might have general soreness that is typical after exercise and doesn't worsen with continued play. Or temporary pain, a brief, non-recurrent pain that subsides quickly and doesn't return during the game. In these scenarios, it would be okay to consider to continue to play, but use your best judgment and consult health professionals if needed. Next, let's talk about those yellow light circumstances where you might need to slow down, but not exactly stop playing for sure. So let's say you have moderate pain. You experience pain that is more noticeable, but you're still able to play with some caution. You might have persistent discomfort, pain that's been present for a while but hasn't significantly worsened or yet impacted your function. Or localized pain, so pain in specific areas like joints or muscles that doesn't impede movement significantly but has become persistent. So in these cases, I would maybe dial back the length of time playing, continue to strength train, continue to warm up, maybe take a day or two off and see how your body reacts. Now, lastly, let's talk about the red light circumstances where you should stop play, possibly at this time. So think of severe pain, sharp, intense pain that occurs suddenly and becomes unbearable. Joint pain in the knees, hips, or other joints, especially and specifically if it's accompanied by swelling or reduced ranges of motion. Functional impact, so pain that restricts your movement and affects your ability to play or even function in your day-to-day life. And then, of course, the obvious signs of injury. If you have swelling, bruising, or instability in any part of the body, you might want to consider reaching out to one of us, a trained health professional, to help you get back on the court as soon as possible. So some of the take-home messages is that sports provide many physical, mental, and social benefits at any age. Now, with exposure to sport, there is always a risk of injury. Try to reduce that risk by using the 3 facets of sport resiliency that I talked about today, including warm-up, strength training, and graded exposure. Then, think of the traffic light approach the next time you may experience some pain. And lastly, if you need help, please consider consulting a licensed professional, especially us here at the Cleveland Clinic. we would be really happy to help. I want to thank you all for your time today. This is a picture of me with some of the athletes I take care of at St. Edward. We got our 3rd straight state championship going for the 4th this year. So again, thank you so much. And I appreciate your time and looking forward to answering questions. Thanks.
Absolutely fantastic. Thank you so much. We absolutely love your use of videos. And just for the audience to know, in about a day, this video in its entirety with those videos incorporated in it is going to come out via email. So you'll have access to the videos that were just shared in the presentation to utilize and share. So please know that that's going to be coming out in about a day. So thank you very much for that presentation, both of you. Fantastic. We have several questions and we have a great duration of time. So without further ado, I'm just going to go ahead and get into these questions, and I will pose them to both of you and direct them at whomever might be more appropriate to answer, but feel free to add and ask each other questions as well. But the very first question that I have, there are a tremendous amount of questions on surgery and replacements and really kind of returning to activity after a joint replacement. So in your opinion, Dr. Tramer, what would be the best approach after joint surgery, either with or without an implant? How would somebody return to something like a pickleball, golf, tennis sport?
Yeah, that's a good question, and something I am interested in and get all the time as well. So I would say that, first of all, the joint replacement surgery especially is a major surgery and undertaking. So returning is, it takes a lot of time, and everything is typically in a stepwise manner. It depends on what joint it is, but I'll use the shoulder, for example, which is the type of joint replacement that I do. Typically there's a period of sling wear, a period where you're not moving it much. So the early phases are really just focusing on regaining your motion, building the strength back up. But once we get closer to, I'll say roughly around the 6-month mark, and people are having good motion and strength, I encourage them to get back to those type of activities. And Hanna had a great slide talking about graded return. And that's my approach. Once you're beyond the 3-month mark from most joint replacements, the implants are really nicely healed, but your body has not yet adapted to the new normal of having the implant. So everything that we do has to be a slow, graded manner over time. And I help kind of coach people through that during the recovery. The therapists are fantastic at doing that because they see you more often than I do. But especially lower impact sports such as pickleball or tennis or golf, those are things that I want you to do after a joint replacement, and we'll definitely work with you to get you there, knowing that it does take time.
Absolutely. Do you encounter when somebody is with you, is there like that kind of fear of overcoming just recovery of surgery? Do you ever encounter something like that with someone?
Absolutely. Especially in some of the things I do, like an ACL reconstruction, there's been a lot of research that show one of the biggest barriers to getting back to play is fearing a repeat injury or having another complication. So there's the physical part of getting back to sport as well as the mental part for sure. And really the best approach is some supervision, which is typically with people like Hanna, and then graduated return.
Perfect. Thank you very much. The second question I have, we have received a lot of questions about injections. Could you possibly discuss the effectiveness of gel injections or the PRP for knee bone on bone? Can cartilage be regrown? But let's go ahead and start with the injections first.
Yeah, and I get that question all the time as well. So as I said during my talk, when the smooth lining of the bones, the cartilage has gone away, we're working on it, but we haven't found a way to put that back in there. For really small pieces of lost cartilage in very select patients, there are procedures I do to put it back, but for degenerative wear and tear type arthritis, there's not really a way for me to put cartilage back into the knee. And as far as we have done in our research so far, there's nothing that we can inject into the knee that will get your cartilage to regrow back to where it once was. Though sometimes things like stem cell or PRP are marketed as such, but there's no evidence to show that that can happen. And usually the effectiveness of those injections is because it decreases the inflammation in the joint, not that it changes the actual structure or regrows the cartilage. So that being said, I still use them very frequently to treat my patients, but the mainstay of injection therapy is just corticosteroid, which is a strong anti-inflammatory, cortisone steroid, and it's very effective at delivering a high dose of anti-inflammation right into that joint. It stays within the joint. It doesn't travel throughout the body and have many side effects. The goal is really to bring down the pain levels so that you can do the therapy, you can get stronger, you're able to tolerate the therapy while the cortisone is working, with the goal of when the cortisone eventually wears off, which it does, that you're in a better place, you're stronger, and the pain does not come back or comes back less than it was before. I do use the gel injections that you mentioned sometimes. The theory is that they give a kind of a lubricant to the joint, but really I think they also have some anti-inflammatory property, and it's just another type of injection that can be beneficial for decreasing inflammation and getting people back to doing things. But there's a lot of smart folks, smarter than I am, working on different types of injections or ways to get cartilage back into the bone, but we just haven't figured that out yet. So it's really doing things to decrease the symptoms and the inflammation rather than regrow the cartilage at this point, at least.
Perfect. Thank you. Maybe we'll do a follow-up event in a few years and there will be some new information regarding.
We're working on it. Yep.
Yeah, we'll see. We'll see, right? I want to ask a question for Hanna. Hanna, we had somebody write in that they're a walker, an avid walker, and oftentimes the back of the knee is hurting. Is that something that you would encourage that person kind of continue to walk, or should they take a rest?
Yeah, it probably depends on the level of pain and how it's impacting their function. If this pain is really only present when they're walking and it's not really impacting their daily function yet, I would encourage them to control the controllables. So make sure you're doing some other activity, maybe besides walking. Maybe you get a little bit of strength training in. Maybe you try something a little bit different. Switch it up and see if you can get the pain to go away. I wouldn't say just because you feel a little bit of pain in the back of the knee right away that you need to stop walking. Often motion is lotion, like I would say, and I would continue that person to try to keep moving. Now, if it starts to impact daily function, you notice it's keeping you from sleeping, it's really starting to hurt a lot more, use that traffic light approach that I gave and maybe consult a health professional if it's starting to impact daily function.
Perfect. Thank you. I'm going to pose this next question to both of you, and I really welcome both of your opinions on this. The role of acupuncture, deep tissue massage, chiropractors, what are your thoughts? Is there evidence to their benefit?
What do you think, Hanna?
Well, so I'm going to say the same thing I just said. First, I would tell people, if you're not controlling the controllables, if you're not sleeping well, if you're not eating well, if you're not exercising and moving, then some of those things probably are not going to do you much good, to be honest with you. If you're not controlling those controllables, it's going to be hard for those things to work. And if you're only trying to do those things in isolation, it's going to be hard for them to work. There's mixed research on a lot of those things, but I would say if you're controlling the controllables, you're still having a little bit of pain, there's no harm in trying some of those extra techniques to try to keep you moving and try to keep you exercising. Think of them as kind of an entryway into those controllables, an entryway into exercise and well-being, not just a complete fix for your pain.
Yeah, that's a great answer. And I would say along those lines, the things that I know have the potential to make a lot of these things better is being fit, healthy, and strong, and decreasing load across the joint. In order to do that, you have to control symptoms. If brace, chiropractor, massage, acupuncture, oils, spices, whatever makes you feel better, you can do that as long as it is safe. Whether or not it's truly effective, or if we did a random trial, if it would work for most people, it's hard to say. But if something works for you and it is safe and low cost, I support you trying it because we're doing everything we can to minimize the symptoms to allow you to do the things we know that work, which is all the things that Hanna has discussed.
Perfect. I love both of those answers, and I thank you both. Hanna, one of the other questions that we have for you is, how would someone ease kind of stiff ankles? Perhaps if they're struggling with arthritis, they have arthritis. What are some kind of, when they're getting up early, they have an early pickleball game, what would you recommend for that early morning stiffness?
Move, right? I would say, depending on your level of activity, if you're used to walking, try to go for a nice gentle walk when you get up. You might consider doing some stretches. I would say just generally moving and dynamic stretching is better than just static stretching. So instead of just getting up out of bed, going over to the wall and trying to stretch your calf, I would say motion is lotion again. Start moving those joints, start moving at a low intensity. And then if stretching feels good to you, work in the stretches that feel good, but I would use that in combination with active movement.
Awesome. Wonderful. Thank you. One of the questions that we have that I know is kind of a little specific, but this is in regards to like after something like a total ankle replacement. Let's say somebody wants to get back to running, jumping. Is there any kind of evidence that would suggest that those movements of running or jumping would either cause that replacement to loosen or wear sooner?
Yeah, so I have honestly limited experience with total ankles personally because they're one of the most rare joints to be replaced. And I do happen to know that that's one of the most fragile ones that we do. So if that's your situation, I would advise against running and jumping with a total ankle replacement. And then when it comes to any other joint, hip, shoulder, what I tell people is that these parts are great. We've spent a lot of time engineering them to last as long as possible, but they're not what you're born with, and they do not last forever. So everything that we do has to be a risk-benefit analysis. So if you can imagine you put in a mechanical part and run and jump on it, it will have a higher chance of loosening up over time versus if you're not. So if that's something that you have to do and you're willing to risk slightly increasing the chance that they need to be swapped out for new parts, which is a major deal, then you can do some of those things. But typically, especially in lower extremity replacements, we don't recommend running for exercise or jumping for exercise. Occasional here and there, playing tennis, pickleball, lower impact sports is fine. Yeah. It's that repetitive impact that becomes a problem that I would recommend against for total joints.
Wonderful. Thank you. The next question I'm going to ask you both, and we get this question. We do a lot of these events and we ask it every single time. And I'm sure you hear this question so many times during the day, but heat or ice, heat versus ice, both of you, where do you start?
If it kind of what Dr. Tramer said a little bit ago about some of the acupuncture and chiropractic techniques, if something works for you, use it. That's pretty much what I tell people. So to be honest, I mean, if you have a really hot, inflamed joint that's really swollen, I'm probably not going to put heat on that. But if you have some general joint pain and you're like, maybe I feel like I should be icing this, but heat helps, I'm not against telling them to do what helps. I don't know if Dr. Tramer has a different thought on that. I mean, that's pretty much what I tell people. Use what helps.
Yeah, I agree with that. And honestly, it's not doing too much outside of like a acute injury, swelling, inflammation. That's something that we ice. But chronic arthritic type pain, just whatever it takes to make it better.
Yeah. Excellent. Thank you. Obviously, I know we discussed this in one of the presentations, but as we age and as we get older, we tend to lose some of our muscles and strength. So with a specific planned strength building program, is it possible over the course of some years to regain some of the strength that you may have had in your younger years?
It's definitely possible to increase. So let's say you're at a baseline at some point and you start strength training. You're going to increase strength. Are you going to reach the same exact strength that you did when you were in your 20s or 30s? Most likely not necessarily. But don't let that discourage you, because even those small strength gains from that baseline are really beneficial for your health. So I would say, don't worry about trying to look exactly like you did when you were 30, but getting out and strength training is really going to be beneficial overall, and you will see differences once you start that program.
Yeah, and I would just add that, the graph I showed, your muscle mass goes like this no matter what we do. So anything we can do to tilt that to be flat or up, or even a little bit, is going to give you benefit long term. And outside of gaining muscle mass, there's many benefits to doing resistance training. It makes you feel better mentally, helps with your balance. So even if you're not packing on muscle, you're doing a lot of things to benefit your body.
Perfect. Thank you. One question that I have for you, Dr. Tramer, is in regards to a torn meniscus. Is it possible for that injury to heal on its own without surgery, or is that an instance in which surgery would be recommended?
Yeah, so this is another one of the most common things that I see and discuss with patients in my clinic. So I'll say that there's two groups of meniscus tears. There's one group where your knee was totally normal and fine, and you had a cutting injury and the meniscus tears off the side. Mm-hmm. That's usually more with like the younger population, and those are ones that I may be more aggressive about going in and fixing back to where it belongs, which is actually what I'm about to do in a few minutes here. And then there's another type where you've had some arthritis, the smooth lining of the bones, the cartilage has worn away over time. It becomes more sandpapery. And the thing between those two bones is your meniscus. So if you can imagine rubbing sandpaper on soft tissue, it's going to get tears in it. And so if I MRI'd everybody in their 60s with zero knee pain, a large portion of those people would show MRI evidence of a meniscus tear, and I would do surgery on almost zero of them. The people that need surgery for meniscus tears are when the meniscus tears and it moves into the wrong spot. It gets caught and pinched between the joints. There's one study that I quote with my patients a lot, is that they used to be really aggressive and say, hey, here's a meniscus tear. We're going to go scope it and clean it out. Mm-hmm. A group of people did a study where they put the scope in, looked at the meniscus tear, took the scope out. The other group, they put the scope in and cleaned it up. And in a year, everyone who had a meniscus tear caused by arthritis was the same, whether or not they actually cleaned it up or not. So will the meniscus heal? Not really. But can we do things to decrease your symptoms and make it so it doesn't cause you problems? Certainly. So it's a very common thing. I'm very conservative when it comes to arthritic related meniscus tears. And I would just caution people who, get surgery recommended out the gate for something like that to really think about it, because there's no problem surgery can't also make worse. So I typically treat that conservatively, but there are instances where there are pieces in the wrong spot that going in and coming out can certainly make things better.
Fantastic. Thank you. Hanna, one of the questions that we received today is, does a neoprene brace from a drugstore, is that helpful for knee pain or elbow pain? Or is there something better that somebody should be looking into if they have pain?
I'm going to resort back to my controllable spiel. So if you've done all those things and you're trying different braces, from what I understand from the research, from what I see in clinical practice, there's nothing really specific that I'm going to be able to recommend for you besides, if it feels better, try different ones. If one feels better than the other, use that. I don't particularly make very specific brace recommendations. Mm-hmm. It definitely does not hurt to try those things. And if they make you feel better, go for it. There's no reason not to try those things.
Perfect. The next question I have, I'm going to pose to both of you. We have been receiving many, many questions on shoes. Are there kind of best shoes for something like pickleball safety? Is there like something, does it depend on the person's foot and their arch? I know it's kind of similar to where, I'm asking you for something specific, but in general, are there specific recommendations for shoes and kind of what to look for when doing different sports?
So there's probably a continuum to this. If you're playing pickleball in your sandals or your Crocs, I would say absolutely. there are better shoes for you. Outside of that, I would tell you, go to a running store. They can evaluate your foot, try to get you something that feels good. But let's say that you get the shoe evaluation done and you have these shoes that are supposed to be really great for your foot and they feel terrible. That's okay. If there's a shoe that feels great and it wasn't the one that you were supposed to have, that's okay. We tell people to be in what feels comfortable, what feels stable. Sometimes if you have some hallux rigidus where you have some really stiff toes, sometimes a wider toe box is really beneficial. So it's a shoe that's not so narrow. But outside of that, you want to find a shoe that feels stable. That's not probably a Croc or a sandal, that feels good on your specific foot.
Perfect. Do you agree? Yes?
Yes.
Perfect. Okay. I know that this is kind of a broader question, but if somebody comes into your office, Dr. Tramer, and they say, I'm getting this intermittent knee pain, what might be some of the causes, or where would you start with that?
Yeah, so I always get x-rays on my new knee patients, and that's an easy way to grade whether or not there's arthritis of the knee joints. And it can help me determine kind of a starting point. And in the vast majority of people who did not have a traumatic injury, who just have oncoming intermittent knee pain, the diagnosis is probably on the spectrum of osteoarthritis. The most common place that I actually see that affecting people is behind the kneecap. What happens is that you get some wear in the joints. It's become sandpapery, like I said, the bones rub on each other. It can cause some pain and swelling. Then your muscle gets kind of angry at the pain and swelling and gets weaker, and that overloads your kneecap joint. So people with like a deep, achy front of the knee pain, which is one of the more common things that I see, the kneecap is typically overloaded and rubbing too much, and the muscle isn't doing its job to offload the joint. So that's usually what I see most commonly with that type of scenario. Obviously, there are other types of injuries like ligament tears, symptomatic meniscus tears. Sometimes people can rupture the tendons around the knee, but those are usually more dramatic and associated with the trauma. So I would say, if you've been dealing with something for a long time, or you have an acute injury, is when it doesn't hurt to make an appointment with us. We're always available and can help sort through these things and decide what exactly might be going on and what to do about it.
Perfect. Thank you. You had just mentioned osteoarthritis, and I do have a question in regards to that. Is there a best way for somebody to prep for a long hike or to lessen their joint pain if they are, if they do have osteoarthritis?
You want me to take that one? So
Yeah. Go ahead,
Sure.
Either. Sorry, I think I'm buffering here a little bit. But can you hear me? Can you hear me?
Yes. Mm-hmm.
Oh, sorry. It was delayed there.
Yes.
I warm up. I mean, get moving before you go on a hike. I would say don't get out of the car and just start hiking 5 miles up steep and uneven inclines. Use some of the warm up principles that I recommended earlier. A little bit of light movement, maybe some active stretching, maybe a little bit of activation exercises before you get into that more intense activity.
Thank you. Sorry, we were experiencing a little bit of some technical issues. Dr. Tramer, is there anything to add?
Yeah, it's just the graded activity thing. So before you do something, just work up to it. Make sure you're loose and limber, wearing the right equipment, well hydrated, and then go for it.
Perfect. Thank you. To just a few more questions here, and then we will wrap up. One of the questions that we received today is that somebody's saying that they're getting leg spasms after in bed, once they're in bed after a day of walking or exercising. Is that normal, or is that something that is a little bit concerning?
I mean, it's doesn't happen to me, so it's certainly not something that's normal and supposed to happen, but it doesn't mean that it probably means that the demand you're putting on your muscles is outweighing what they're ready for, is typically what can cause something like that. So having a look at, if there's something specific that's causing it, if you did something during the day consistently that does lead to that at night, or if it happens every night, there's a wide spectrum of things that can cause spasming even outside the musculoskeletal system. So if it's something that's consistent, then it's not something I would ignore, and at the very least, mention it to one of us or your primary doctor, and things can be looked into further to decide why it's happening. Because having some spasm here and there, especially after physical activity, can be normal, but consistently on a daily basis, I would say is certainly outside the realm of normal.
Thank you. I think that's very helpful. I'm going to pose one more question to both of you, and it is the same question, and I know that you have answered this in various forms, but I guess just something to leave our viewers on one last time. What is the difference, and how do you know the difference between a simple pain in one of your joints from activity and knowing when is the appropriate time to see somebody and if you should just immediately stop? And I know, again, we've gone over this, but I'm going to ask you both just to kind of end us and finalize the event. Hanna, if you'd like to go first, what would you recommend? What is kind of your closing point on that?
Yeah, if it's a brand new pain, I wouldn't get super worried about it unless it was associated with some sort of like mechanistic injury, like you stepped off something and you felt really bad pain, and if that pain continues to linger and impact your daily function, and that's something that's concerning. If it's a pain after some physical activity, there was really no incident that you felt anything, it kind of comes and goes, it's not impacting daily function, control the controllables, do all the things we talked about today, see if the pain subsides. If not, consider seeing one of us. Kind of be my answer to that question.
And Dr. Tramer.
Yeah, along with similar lines, I often tell people that, muscle soreness, some pain during exercise can certainly be normal, pain immediately after exercise, but when it's lasting into the night, it's affecting your sleep, it's lasting into the next day. Those are things I don't like. I don't like limping. That puts pressure on other areas of the body. So if you're not walking normally, if it's affecting your sleep, if it's lasting more into the next day, and not kind of coming and going, those are reasons where I think something more needs to be done, or at least worked up to gauge why exactly it's happening.
Perfect. Thank you both so very much. And thank you to everybody who tuned in with us. Just a couple of pieces of information on what is coming next. And as I mentioned earlier, in about a day, you'll be receiving an email from the Cleveland Clinic regarding this recording. You will have it in its entirety, and you will be able to view and share with friends, family, anybody that might benefit from this, or again, to watch at your own leisure and whenever you would feel like it. So that is something that's going to be coming out within the next day. The other piece that I'd like to let everybody and remind everybody to know is that, again, on the right-hand side where you see the Q&A where we were putting all of the questions, and there are some really great helpful handouts that are there, not only in regards to Cleveland Clinic, but again, our partners at the Arthritis Foundation and just some general information. We do want to let you know, and we're going to send out this offer again, if you would like to schedule to see Dr. Tramer or one of his colleagues, if there is a need for an appointment, you can go ahead and send us a quick note here. It just kind of flew out on the schedule now. And then we also have a QR code. You can make an appointment. You can take a look at some of our treatment guides or video series, past videos that we've done, and hopefully just a really wealth of knowledge for you if you are out there and you're struggling with some kind of pain related to a sports injury. So thank you very much to both of our presenters. And again, thank you to everybody who tuned in with us today. What a wonderful event. And we hope that you have a fantastic rest of the day.
Thanks.